Doctors, what was the most overdramatic or underdramatic patient you ever had? I think we all have seen our share of overdramatic patients or heard the tales, so I'll go with the less common underdramatic patient. Patient presented to the trauma ER with an 18-inch machete blade firmly implanted across the top of his skull. He was driven to the hospital by a friend, possible assailant/owner of said machete, ambulated on his own to the ER, had totally normal vital signs and triage, a slight steady trickle of blood from the wound, denied pain, and was in no apparent distress. Due to a mass trauma event, the ER was insanely busy, so it took us a while to get him a bed. In the meantime, he calmly sat in the waiting area, nearest to the triage station, so we could keep an eye on him, and watch TV. His staff were running around like crazy, phones ringing nonstop, patients bickering about the wait time to be seen, and exhibiting other types of tomfoolery. Machete Man just sat there tranquilly exhibiting his true Zen mastery of machete head wounds. All these years later, I can still see him with that machete lodged in his skull. He had an uncomplicated treatment course and suffered no impairment from the injury. He was cooperative and nice to all his caregivers. He also profusely thanked us for caring for him, probably one of the few that did that night. Yeah, I feel like this is just a visual and experience that will never escape anybody involved. A, the fact that he survived. B, with no, apparent long-term ramifications. I mean, it's just a crazy story to tell. Next story. Not a doctor. My dad's story. Old guy that needed a pacemaker. Worked a farm in Utah, I think. He realized at some point that when he started having an episode, he could just grab the electric fence and it would stop. So this badass just ran fencing everywhere he could on his property and grabbed the fence if he had an issue. Been doing this for months, if not years. Thanked my dad for putting in the device, saying how he can finally get out to areas of his property that he couldn't run fence to. Next story. Farmers are notorious for being underdramatic. Had a farmer a while ago who was up a tree for some reason and fell out. As bad luck would have it, someone had left a dirty meat hook at the bottom in a tree and he landed on it, impaling his butt cheek. He proceeded to pull it out, finish what he was doing, and drive himself home and go to bed. The only reason he came to hospital was because his wife woke up to a bed full of blood and insisted he get that looked at. This is taking being butthurt to a whole other level. Would not recommend. Next story. 60 to 70-year-old lady arrives at trauma ER. She was being chased by a cow, running for her life, and fell off a effing 2-meter ledge. She had several fractures, but only really complained about her leg, and tried to get up and walk away several times, telling us she was fine. Initially, we thought she had some head trauma and was completely disoriented, but it turns out she was just that stubborn. She was hospitalized for a while and had a good recovery. I do wonder if the cow fell off the cliff as well, lol. Next story. Not a doctor. Young trauma patient, about 17 years old and T-boned by a garbage truck. Moving him on to the CT table, he said, "Ow," and silent tears came down his face. Then he apologized for complaining and thanked us profusely. Turns out he had a few broken vertebrae, broke half his ribs, and had a fractured hip and clavicle. Kid whimpered a few times during the CTs and again apologized when we came back in. Like, dude, you could scream in my face and I'd understand. Next story. We were doing paternity testing for an apparently extremely acrimonious case of, "Your son impregnated my daughter." "No, he didn't. Your daughter sleeps with lots of other boys." Each side sent a lawyer to the appointment. Each lawyer had their phone out recording and followed the blood and cheek swabs from collection, through the lab for DNA extraction, performing the test in our PCR room, and watching me analyze the data files, which is exactly as boring as it sounds. It's like, dude, you are the natural third-party lab here. We have literally zero interest in the outcome of the case. You don't need to be so dramatic. All the chain of custody stuff is documented. We have a second observer signing off on sample IDs. We're not going to risk losing our license by accepting a bribe from either set of parents. Next story. Overdramatic. Tons of stories, but the most recent was a patient demanding a heavy Percocet RX. Far more than I had prescribed, even post-surgery, after having a nasal swab for COVID-19 completed. I get that it's temporarily uncomfortable, as I've had it done several times myself, but no way was I buying him writhing around, screeching about how much pain he was in. When the patient eventually realized I wasn't budging, it was as if someone had flipped a switch and he miraculously recovered. Underdramatic. Patient tried extracting his own tooth and inadvertently pushed it up through the abscess and into his right maxillary sinus. To my surprise, he adamantly declined even local anesthesia, no matter how much my staff was pleading with him. Patient autonomy is a gray area here in the US, given how insanely litigious everything is. So, after receiving clearance/written consent to proceed with treatment, I figured he'd just have to learn the hard way. Instead of performing lateral window root tip retrieval, I took a surgical suction tip/curette and removed all 3 fragments through the alveolar ridge, warning him several times beforehand that it would hurt like hell. The guy never even flinched. I was able to complete the procedure, debride the infection, and graft the floor of the sinus with membrane/sutures without incident. Go figure. Next story. Not doctor, but EMT. Had my fair share of overdramatics, though I would say most of them suffered from some sort of mental impairment or dementia. Most were manageable, but I do remember this one woman that we had to take dialysis on a regular basis. It was always hell from the moment we walked into her nursing home room. "Who are you? What are you doing to me? Help, I'm being kidnapped. They're going to SA me," etc. I'm pretty patient. The first maybe 5 or so times we can hear her, we were very slow and gentle with her. I would explain multiple times to her who we were, what we were doing, showed her our IDs, and so on, but the screaming and yelling and flailing would continue. One day, we picked her up from the dialysis center, and they told us that she was absolutely not welcome back unless the nursing home started highly medicating her. See, not everyone that goes to dialysis is old and feeble. A lot of younger folks come in on their own power, and they told us that nearly a dozen clients had stopped coming in and switched centers due to her outbursts. In the USA, healthcare is a business. Most underdramatic was the gentleman that we were taking from an ER to a specialty trauma center. He had been in a bar and witnessed a bar fight. He tried to break it up. One of the guys smashed a beer bottle over his head. Spoiler, it's not like on TV. The beer bottle was hard enough to break his skull, but it also broke the beer bottle. The way the impact hit it partially popped his eyeball out of the socket. Then the broken beer bottle traveled down his face and sliced the eyeball in half. Very few injuries bothered me that I saw as an EMT, but the second I saw his face, my eyes just started watering. But he was the calmest, most polite Mexican gentleman. Only spoke a little English, but everything was "sí, señor," or something of equal politeness. Didn't utter a single complaint. Next story. I'm a nurse, and we had a patient recently who was palliative, expected to die naturally. His body functions were only at about 10%. He wasn't eating or drinking, and he wasn't peeing or defecating anymore. He just laid in bed with his eyes closed, breathing. When people get to this point, usually the only care we provide is for comfort versus sparing life. So we don't give people food or water because they're usually unconscious and more likely to choke and be harmed. This patient's daughter was some big shot lawyer from the US, and when she saw that we weren't feeding her dad, she started recording everything we did and said to her, and then phoned the police. I remember a police officer coming to the unit, asking to speak to me, the most responsible nurse at the time, and asking why I was withholding food. I explained to the officer that I had physician's orders to withhold food, and that the patient was at a severe aspiration risk. The police officer was like, "Cool, case closed," and left. The daughter was unfortunately banned from the hospital premises by management for interfering with patient care. Next story. I was in my last week of school as a rad tech student, and a patient came in to the ER for a series of x-rays. He claimed to have fallen down some stairs, and we basically had to x-ray both legs from the knee down. Reader, I have never met a bigger, whinier baby. He moaned and groaned and flinched at the lightest touch, refused to hold still, would not straighten his legs, complained about the table and x-ray cassette being too hard. There were no visible injuries aside from a few scrapes, and nothing obvious on the x-rays. He was still convinced that he would never walk again and had broken both legs irreparably. Funniest part was we had a different patient come in on the same day with a similar complaint. He actually had fractures in both legs and feet and was very calm and cooperative for the x-rays despite his injuries. Next story. Not a patient, but a family. Third year of my residency in emergency medicine, we went to lead the trauma bay, with extremely immediate supervision, of course. Since we advance ranks in July, my first shift happened to fall on July 4th, a holiday well known in EDs everywhere for being a special mix of booze and fireworks. We got an alert that EMS was bringing a coding gunshot patient. Now, if a patient with penetrating trauma loses pulse before the hospital, the odds are dire, but it later turned out that this patient had no vitals even on EMS arrival. They realistically died before the ambulance arrived, but the commotion on scene was such that EMS decided to extract and transport rather than call it on scene. Patient arrives, clearly already having bled out. We went through the usual motions, looking for anything fixable, and I called the code. Then I went to the family room to break the news. This is a skill that's carefully taught. Assemble the family, sit down, make introductions. Find out what they know, get a sense for how they speak so you can match them. Be empathetic but also very concrete. Answer questions. I had a grouping of 3 or 4 family members, and I did all the things, and it went okay. Then, over the next 15 minutes, another 20 family members trickled in, festooned in red, white, and blue, largely quite intoxicated, and they yelled the news to each other out of my control. And as each one joined the room, it got wilder. People not only cried, but they screamed. Soon, an auntie was vomiting in the corner. 2 small kids were ignored, wide-eyed off to one side. A grown-ass adult man actually lay on the floor and kicked himself around in circles like Homer Simpson. I've never seen anything else like it, before or since. Next story. Overdramatic. I couldn't even begin to describe this. The percentage of the population who cannot cope with life is ridiculously high. I regularly see young adults hysterically crying because they have a cold or some small injury. Sure, I get it hurts and you don't feel great, but come on. Underdramatic. The one that stands out was on an OBGYN rotation when I was in school. This stoic Eastern European lady went into labor while she was at work earlier in the day. Apparently, she never called her husband to tell him, so there she is, about to start pushing, and her husband calls her. She just says, "I'm having the baby." Then there's some pause where he says something. She replies, "No, you can stay there with other child's name. I'll be home tomorrow." Then she hung up and pushed out a baby. Next story. Undramatic patient here. I stepped down wrong on a stair and rolled my ankle, or so I thought. I was 22 and in good shape and figured after a few days it would be fine. Apparently I had a small break in the bone on the outside of my ankle that was grinding together as I started walking on it. It was uncomfortable, but I could walk around on it, so I figured it was fine, just a slow healing sprain. One day, a week or so later, I stepped down and all of a sudden I hear this terrible crunching noise. Apparently, the small break had continued to slowly get worse and the bone basically slid over and completely severed the tendon. It rolled up into my calf, like Kurt Schilling, and the crunching sound was my bone just grinding into a total mess of a very bad fracture. Since this has been going on for a few weeks, I don't go to the hospital. I call and make an appointment with the orthopedic doctor for x-rays. We'll never forget the tech's face. They wouldn't even do the x-ray and went for the nurse, who went for the doctor, who immediately scheduled me for surgery. They could not believe I was still walking on it. I still maintain it hurt less than a broken toe up until everything turned really bad. I just figured it would heal. Anyway, they had to reassemble my ankle and then drill holes in my leg bone to tie my tendon back into place. And it was my right ankle, so I couldn't drive for ages. Total nightmare. Just always get x-rays. This is just another example of the hazards of underestimating, injuries that you think you can just manage and push through. Eventually, no one in this world is ever getting younger at any point in time, right? So eventually these things will escalate and manifest into much bigger problems. So yeah, get those x-rays. Just go to the doctor. Next story. Told this story before, but it still shocks me. Not a doctor, but my friend tended to a very underdramatic patient during her nursing placement. The doctor was talking to the patient while my friend was inserting an IV. Then, without warning, he projectile vomits all over the place and onto the doctor and my friend. The following conversation ensues. Doc says, "Are you all right?" The man goes, "Yeah, sorry about that. It happens sometimes." "How often?" "A few times a day." "How long has this been happening?" "Oh, for the last 3 years, I think." My friend didn't see that patient after that, so we never really found out what it was. It was so long ago that I can't even remember what she said he was in for, but I know it was for something completely different. Next story. My doula said the pregnant ladies that come screaming into the maternity ward, "The baby is coming now," fall into 2 categories. One, they're dilated to 1 to 2 centimeters and are hours to days away. Or they're minutes away from birth and they have the baby within 10 to 15 minutes tops. The last lady like this was the day before I came to give birth, and she didn't make it to the elevators from the parking garage. Next story. Guy I did construction with accidentally hit himself in the lower abdomen with a nail gun. Had fluid leaking out from around the nail. He takes it out, and even more starts coming out. Was pretty sure it was pee. Went to the hospital, very calmly holding his finger over the hole. Told them he thought he might have punctured his bladder or something. The nurse said that wasn't very likely, so he took the finger off to show her the fluid leaking out. Once again, a solid stream of what was most likely actually urine came pouring out. much like he was peeing through a hole in his abdomen. She fainted. They had to do some minor surgery to close the hole. I would imagine he's someone's underdramatic patient story. Next story. Not a doctor, was in a mobile aid station and one of our guys caught a bullet in the ass during a live fire exercise. He just laid there calmly as we got vitals to hand him off to the ambulance. And the only thing he requested was a blanket because he was cold and all the officers were crapping themselves because someone got shot during training at night. I was crapping myself because I was on radio guard when it happened and my NCO was gonna F me up because he thought I was asleep. They admitted to not calling to let us know. Next story. One of the tensest staff situations I've had. We had a Jane Doe trauma code, a pedestrian hit by car, polytrauma with clearly non-survivable injuries to the head and neck obscuring her features. But as we cut her clothes off, the nurses exclaimed, "It's that person!" Recognized her jewelry. She was one of our frequent flyers, a lady with severe schizoaffective disorder and chronic depression, whom we all knew very well. By EMS report, she had jumped out into a state highway in front of a car, wearing dark clothing at night. It's hard feeling like we were in a sense her only family. We were gentle with her and genuinely grieved. And then EMS brings us a patient having a panic attack. He had been driving on a local state highway at night when someone jumped out in front of his car, and he was terribly afraid the person was badly hurt. I don't work in a large place. There were some delicate logistics involved in keeping her body and the state police photoing her away from him. Next story. As a med student, I was third row in helping try to code a dying GI bleeder. People who have end-stage liver disease don't make clotting factor well, and also have anatomical difficulty that leads to big, ropey, vulnerable blood vessels in the stomach that are at risk to bleed. And when people bleed inside the stomach, you can't hold pressure. You must simply get them stable enough to have life-saving endoscopy and clipping of the bleeder. This guy was at exorcist level vomiting bright red blood. He was exsanguinating into his stomach, and we couldn't get his blood pressure to stabilize enough to get a scope into him for a while. There were runners bringing us coolers of emergency release blood, and the splatters and pools of blood he had vomited reached across the hall. When we finally got him packed up to go to the endo suite, the family next door quietly apologized for taking our time for their chronic, non-emergent issue, and could they go home now? Next story. I'm not a doctor, but I feel this story fits. When my mom went to have my sister, she went into her room. The doctor came in. When he looked to see how the baby was doing, he said, "Ma'am, do you know you're in labor?" My mom said, "She's just stretching." The doctor replied with, "You're in labor as bad as the woman across the hall." "What's the woman across the hall like?" He went quiet, and you could very faintly hear her screaming from across the hall. Next story. My mom was called in to help with an emergency. Went to the ward where a girl was sat up in bed, conscious, quite calm and talking freely to medics. Mom realized as she got closer that the girl had argued/broken up with her chef boyfriend, who had sunk a 12-inch carving knife into her stomach. The girl just sat in bed, chatting with a towel wrapped around the knife stuck in her belly. My mom couldn't believe it. Never remove a knife from a stab wound or you might bleed to death. Also, don't piss off chefs. Next story. Not a doctor, but work as a PA in the ER. Farmer came in for bilateral hand injuries by private vehicle. Hands were wrapped in towels. Calmly told us that he was helping birth a calf by wrapping twine around the protruding legs and pulling. Mommy cow decided to take off, and the twine became tangled around his hands. He's covered in manure because the cow dragged him a bit face down, unwrapped his hands, and he still had the twine embedded to the bone in 3 of his fingers. We unwrapped the twine, and there was nothing but bone still intact underneath. Still completely chill. Started on IV antibiotics and began to wash the wounds. This was the point where I called a hand surgeon and transferred him. Next story. Not patient, but a doctor. I got a really weird allergic reaction a couple years ago, to the point all my skin started peeling off, like from sunburns. I got an appointment with this supposed great dermatologist, and as she looked through my test results, she had the nerve to say, quote, "Everything is perfectly fine," after which I shake my head and cover his desk with my skin pieces. LOL. Went from calm to freaking out in less than a sec. I'm sorry, but if there's observable trauma here, how can you say that everything is fine, even after running tests, like you can see what's wrong with them? Next story. Med student here. In my OBGYN clerkship, this woman came in pretty hesitantly at the urging of her girlfriend for pelvic pain. She apologized if she was wasting our time and said it was probably nothing. This poor lady had a cyst the size of my head on her ovary that caused torsion. twisting and cutting off blood supply. She was rushed into surgery but lost that ovary. People say it's more painful than childbirth, and here she was, apologizing to us. Next story. I think I was the underdramatic patient. I was 12 and had cramps and was throwing up because of the pain, but I didn't feel like it was very concerning because I was on my period, so it was normal to me. My mom, however, didn't trust it and made an appointment with our GP, who immediately sent me to our local hospital because she was concerned. We didn't have a car, so my mom and I cycled an hour to get there. The GP had called ahead, so they were waiting for me with a wheelchair, which I tried to refuse. The pain was in my stomach. There was nothing wrong with my legs, and I could walk perfectly fine, thank you. Doctors didn't buy it, and I had to sit in the wheelchair, though. During and after tests, I talked to the doctor helping me. He didn't believe I cycled to the hospital until my mom confirmed it. He said he'd seen grown men twice my size come in with infection levels half of mine and be unable to move because of the pain. Tests come back. Acute appendicitis. Got emergency surgery to remove the offending organ pretty much immediately. Same evening, I'm asking whether I could go home yet, as I was very bored. Was let go the next day 2 hours earlier than officially allowed because I kept asking. The next day I was back at school, and 2 days later I was back to running and jumping without a care in the world. A couple weeks later, I had to come back for a final inspection/checkup, and was told that if I'd been as little as 2 hours later, the infection likely would have killed me. Doctor called me the toughest patient he'd had, though that might have been an exaggeration because, tiny 12-year-old girl. Edit. I forgot to mention that during that last checkup, he also revealed that they somehow checked the appendix after it was removed, and I'd had multiple infections before this critical one. They just always kind of coincided with my period, so I never noticed anything was seriously wrong. Sadly, the periods are still painful. Look, I'm not a woman, obviously, but I'd have to imagine going through this one time to, forgo painful periods for the rest of your life would absolutely be worth it. Am I right, ladies? Next story. Not a doctor. Personal story. Broke my wrist when I was 6, almost 7. Was running the pacer test in elementary school. My shoe became untied in the 8th round. If I stopped to tie my shoe, they would have counted me as out. 10th round comes along and that awful beep goes off and I booked it to the end. Stepped on my shoelace and tripped. I tried to break the fall with my left hand and it folded underneath my body and I heard a very disgusting and loud crack. My wrist broke in 3 places. I cried on the way to the nurse's office and then fell asleep in the car ride to the hospital. When the doctors had to break my wrist back into place, I only had a single tear, barely whimpered. Meanwhile, a grown-ass man, probably 40-ish, had to get a shot because he got bit by a bug and he had an allergic reaction. You could hear him screaming at the top of his lungs because of the shot. It was hilarious. The doctors couldn't stop laughing. My dad was losing it while his kid was getting their wrist put back into place, and this 40-year-old dude was losing his crap over having to get a shot for the severe allergic reaction he was having. Next story. Oh god, this could have been me. One time I was driving down the road and some crap flew in my eye. Not literal crap. Well, I figured it would work itself out. I went to the doctor's when it didn't a couple days later. He said, no problem, I can get that out. He proceeded to give me what I can only describe as cocaine eye drops and proceeded to dig out the crap with a effing needle. Now, I don't know if any of you have ever gotten anything dug out of your eye before, but you can't close your eye and you have to watch this needle come at your eye until it disappears, and it's nothing more than a ghost moving around in the jelly of your eye. This whole time I'm freaking the F out, cussing, being very vocal about the entire experience. Then he hits the object, and the way your brain registers that vibration in your eye, it sounds like metal hitting on a rock when he makes contact. A high pining noise every time. The whole experience was entirely effed up. 0 out of 10, wouldn't do again. Well, OP, I'll say this, you did an amazing job of describing that experience, and because so, it was extremely traumatizing for me to even read. That sounds horrible, absolutely horrible, like I'm squirming in my chair as we speak right now. Ugh. Next story. Depressed drunk fella at a bar jumped up onto the bar and got both his wrists deeply with a Bowie knife. He got swarmed by the crowd, tourniqueted, and brought to us. Vitals okay, and with trauma and hand in attendance, we cautiously let the tourniquets down. The anatomy was pretty cool. You could see all the flexor tendons of fingers, completely transected. Not much in the way of bleeding. close it loosely and we'll do a proper OR repair tomorrow. Hand tells us and leaves. Mammals have two sorts of blood vessels. They're the veins, which are thin-walled and compressible and carry blood from the extremities toward the heart. And there are the arteries, which have smooth muscle cells in their walls in order to handle the pressure of the heart beating blood into them, toward the extremities. This fella taught me a thing. So there's this creepy life-saving thing that arteries do. If a patient is bleeding out and gets hypotensive, the smooth muscle in the wall of the artery can spasm down and stop the bleeding temporarily. And the radial artery, spasm down, looks goddamned exactly like a flexor tendon to the entire surgical team. So they left him with me. And 15 minutes later, once everyone had left the room to make calls and enter orders on his behalf, this last-ditch survival thing relaxed, and he quietly, drunkenly, filled the floor of his room with blood. Next story. My brother had a head cold, so my mom took him along with us to my asthma appointment to ask my doctor for some advice. My brother turns into a huge baby anytime he gets a cold, so he was acting like he was dying. The doctor is busy palpitating my back when my brother decides that instead of sneezing like a normal person and pinching his nose, he's just going to snot rocket everywhere. The MF blows a huge snot bubble and just sits there with it. Doesn't ask for a tissue or anything. My mom had to literally wipe his nose for him. He's not even little at this point. He's like 12. The doctor was mortified. I wanted to yeet his ass out of the third-story window. Next story. The underdramatic are more interesting. Mid-70s woman, generally healthy, presents to outpatient neurology clinic with an altered gait. Dragging feet more than usual, feels like she's tripping when walking up steps. Family describes tendency to repeat herself more often. Neurological examination normal other than a slightly odd, slow, and dragging gait. Honestly, looks like she's faking an odd gait. Suspect malingering, but above average amounts of liquid in the areas surrounding the brain can give these types of symptoms. CT scan on the brain. Almost half of her brain was smushed to the other side and filled up with water. Massive subarachnoid cyst. Think intracranial water balloon. Probably been growing for years. No other symptoms. She only came into our clinic since her daughters were worried about her memory. Made a full recovery by draining the fluid. Still makes me wonder how many people out there are walking around with half a smushed brain without knowing about it. Next story. Not a doc, but while doing a ride along in an ambulance, we picked up a guy that fell off a skateboard ramp. He'd landed on his forehead. Can't remember if he had a helmet or not. Probably not. He was in good spirits when we arrived and never lost consciousness and could walk, looking a little bruised, talking, pretty with it. This was before concussions were as well understood, and we figured he probably had a moderate concussion and a black eye, and that was it. He almost turned down the ride to the ER, but we convinced him not to mess around with possible head and neck injuries and get checked out just in case. Good thing he didn't, because on the way, he started losing consciousness, blood pressure, vomiting huge amounts of blood, unconscious, and very low vitals by the time we got there. It was crazy how quickly he went downhill. This was only like a 10-minute drive. Turned out that whole quadrant of his face/skull was crushed, but instead of bleeding outside, the blood was draining down the back of his throat into his stomach, so it didn't seem that bad at first glance. We made a crucial mistake by deliberately not touching his obviously banged up forehead to not cause him more pain. Normally, you would do this as part of an assessment. Had we done that, his forehead and elbow ridge would have felt soft and spongy, a very clear indicator he needed to get to the ER pronto with sirens and lights and have the ER surgery ready. He ended up with massive brain swelling and emergency brain surgery. The silver lining is they found a previously unknown brain tumor that was removed and he made a full recovery. Next story. Not sure how fitting this is, but my mom once has to give under for surgery with her ankle. She was in pain the whole way to the hospital, but when she saw the nurse coming with the IV, she suddenly shifted from pain to saying, "Oh hell no, you are not doing that. Go get me someone else." I guess she had this nurse before and did not like how she put IVs in or anything sharp. She refused to let her do anything involving pointy objects during her stay. Next story. German paramedic here had an alarm for a heart attack. So we drive out to the patient's address and are greeted by a middle-aged gentleman with a patient's chart and a suitcase. Of course, one would suspect a family member of a patient with known problems. But no, he said he is the patient. He is having a heart attack right now. His only symptoms were a slight itch on the spine. We were understandably annoyed and disbelieving. In the ambulance on the ECG, however, we got fast. That guy, talking with my colleague while I fixed the meds, had such a massive heart attack that it would kill him in an hour or less. He was chill all the time, joking and telling stories right up to the CPU. Next story. Two connected stories. Lady with bilateral below-knee amputations in a wheelchair. No idea what she was actually in the ED for. I'm OBGYN. Y'all mother effers trying to kill me. Bunch of fake-ass doctors and nurses. I'm gonna die here with y'all. I'm calling a mother effing ambulance to save my ass. Police officer goes, "Ma'am, why don't you calm down?" "F you, I'm calling an ambulance so I don't die here." "Ma'am, you can't call an ambulance. You're already in the hospital." "Well, I'm in the hospital and they're gonna let me die. That's murder. I'm gonna call the police." "Ma'am, you don't have to call the police. I am the police." "You're unprofessional as F. I'm getting your ass fired." Lady calls 911 and the dispatcher picks up. She immediately gets into an argument with the dispatcher, threatens to kill the dispatcher. The dispatcher then seems to try and collect her information, given that she just made a legal threat against a law officer. I later see her in the lobby. She recognized me, called me a punk-ass female dog for not helping her, then asked me to buy her a lobster roll from the mobile lobster truck outside. Dudes would park out front every month or two. Kinda pricey, but for mobile fresh lobster in the inner city, hey, once in a blue moon, it's cool. By the way, this is the Bronx. Fast forward a month or two. Homeless guy chillin' in internal triage. Seems drunk or high or psychiatric disturbance or something. Not wearing pants. "You sons of female dogs said I could have a sandwich. Where's my food? I heard you mother effers had lobster here. Where's my mother effing lobster, you bastards?" Edit. I did not buy anybody a lobster roll. Next story. So I'm one of 3 daughters of 2 general practitioners. I'm sure my parents are good doctors to other people, but when it came to us, they tended to tell us, "You'll be fine," and that was that. An iconic story is when my sister fell off the balance beam on her elbow during a gymnastics class, and my parents told her to just suck it up because, quote, "it's the weekend and we don't want to bother the doctors on the weekend shift." She lived with a pretty badly broken elbow for 2 to 3 days before my parents finally decided to take her to the hospital. But the main story I wanted to talk about is when I was 7 years old. I was quite overly sensitive as a child, so when I told my parents my left hip was hurting, they put a hot water bottle on it and left it at that. But then I got a fever and it didn't go down, and at a certain point I could not move my leg at all anymore because my hip hurt so bad. And when we eventually got to the hospital, because my parents realized that maybe this wouldn't be fine, it turned out I had a severe infection in my hip joint and had sepsis. Spent 2 weeks in hospital and 14 years harassing my parents. So far, lol. Next story. Not a medical worker, but I was the underdramatic patient. I was 6,482 months pregnant and started having pains. It felt like I was being torn apart. I told my husband it was time to go to the hospital, so we grabbed our stuff and headed out. Arrived at the ER and I was told to wait, so we waited. I sat there patiently reading and had an occasional spike of pain, but I stifled my crying and just dealt with it. My husband was all worked up and asked them 100 times when I'd get taken in, and they told him, "We're really busy, but someone will come and get her shortly." About 20 minutes go by and a woman brought a wheelchair for me, loaded me in it, and whisked me away to her room. The nurse kept telling me to grow up and stop being dramatic, which I was not being at all. More than once, she scolded me for crying, saying, "It doesn't hurt that bad," and "Did you see the guy with the broken leg? He has a reason to cry." I was kind of in shock, I guess. I laid in the bed wincing and crying silently to myself, afraid to get bickered at for being dramatic. I'd never had a child before, so I wasn't sure what to do. The doctor came in, put my feet up, took one look and yelled, "She's crowning! Why didn't anyone say something sooner?" One hard push and out popped my son. Labor only lasted 3 hours, so I was very lucky. So OP, in no way, shape, or form am I hating. I just find it kind of ironic that you're like, I was an underdramatic patient, and then immediately next sentence, I was 6,482 months pregnant. Like, that's not an exaggeration. That's not being dramatic, right? Next story. Obligatory, not the doc, but the patient. Went into hospital the week before my usual blood test results. I'm diabetic, and a few days later, I'm having issues breathing and even eating. Heart feels like it's about to burst out of my chest at any moment. I feel like I'll have panic attacks. This was a few months ago, so the fear of having caught COVID at the hospital was very real. So a few days later, I walk into the local clinic, and when they ask me if I have any COVID symptoms, I tell them I have trouble breathing. At this point, I genuinely think I'm infected. Turns out I wasn't. I was just being a drama queen, and I made everyone at the clinic, as well as my own mom, worried for nothing. Still had to go through a bunch of tests, but better safe than sorry. Or dead. Next story. Not a doctor, but when I was an intern, this guy came in and was screaming, like absolutely insane stuff. Apparently, attempted self-unaliving, according to EMT, who had no idea what was happening. His wife was poisoning their child. They didn't have a child. Everyone was killing him. Full psychotic breakdown. We thought it was drug-induced. Doctor later came and explained what happened to me. Guy was fine. He had severe narcissistic personality disorder, and his family had basically said he needed therapy because he was abusive towards his wife. He had a meltdown and took off and started all this to, I kid you not, in his own words, quote, get the cops to arrest the female dog for not making me dinner properly. There was like pages and pages of notes and insane things written the wife brought in to try and help the doctors understand. The wildest part was this was a very conservative Muslim family, so they were absolutely baffled by his behavior. To this day, I'm still confused by the amount of drama it caused. He didn't actually take anything like he claimed or drink anything, and his psych eval was clear, except for the narcissistic personality thing. So no actual psychotic break signs, and we had a psychiatrist witness the entire thing to determine what happened. Wild ride. Biggest underdramatic was a story I was told by a tech. Woman was brought in after a fall saying she was in pain, in her 30s, but very calm. Apparently she got ignored for like an hour plus until this tech asked about her CT. Finally got her one. She had 3 fractured ribs, a punctured lung, and a dislocated hip. Allegedly, her calm demeanor meant she couldn't possibly be injured or in pain. She was a chronic patient, like myself, who regularly had injuries but knew to stay calm or things would get worse. She got a lot of apple juice and apologies. Next story. Not a doctor, but a firefighter/EMT. Most underdramatic, dispatched with law enforcement for an assault with injuries. Get near the scene and was cleared by PD that the scene was safe while they were actively searching for the assailant and that our patient was sitting on the bench of the bus stop. Guy was about 30 years old with a decent laceration on his face, but nothing major. Stated he was jumped by some guy in the bushes out of nowhere and had to fight them off. He didn't really complain about his laceration too much and stated his back was a little sore and that he feels fine and didn't want to go to the hospital. Vitals all look good and he appeared fine, but just to be safe, I wanted to give his whole body a look over to be sure he didn't have any other lacerations, and God was I glad I did. As I pulled this guy's large coat off, winter at night, I see a knife protruding from his lower back with a slow but steady stream of blood coming out. I was as shocked as I was. Next story. I'll admit to overdramatics. I'm absolutely terrified of needles. Panic attack every time I have to get a shot or get my blood drawn. My last doctor that wanted to do blood work actually listened to me and gave me a prescription for a single Valium. I have genuinely passed out before because of a flu shot. I would definitely classify that entire thing as overdramatic, but I can't stop. So my Dragon Ball Z fans out there, all I can think of is Goku, the mighty, strongest character in the entire anime, being terrified of needles and just like heading for the hills anytime he has to get a shot. That is insane, but I get it. Next story. I was the overdramatic patient. When I was like 8, I fell and cracked my head open. That was no big deal. I've had stitches in my head a few times before, but never staples. They gave my mom a staple remover and told her to pull them out in like 2 weeks, and I wouldn't let her do it when the time came, so we went to the ER. Long story short, 2 nurses had to do it, with one holding me down and the other pulling them out. It's been a decade, so I don't remember their names, but I'm really sorry. Next story. Okay, late to the thread, but what the hell? This happened a couple days ago. Not a doctor. A woman walks into the ER walking very bow-legged. She seems calm and explains that she has some swelling in the right side of her external genitals. She thought she may have had an infected cyst, and she drove herself, hoping for help draining it and antibiotics. We didn't think much of it. It clearly wasn't a rush to the front of the line emergency. So an hour or so later, they bring her into her room. She has a fever and high blood pressure, but still calm and stoic. So the NP gets her story and has her remove her pants and underwear and cover with a sheet. She's apologizing profusely about not being able to clean herself very well before coming in. When NP pulls up the sheet, her labia has swollen to the size of a coconut. She had an abscess that was starting to cause sepsis. The only emotion she showed was embarrassment about not being able to clean herself because of the pain and a single tear down her face when they wheeled her to the ER. Next story. Obligatory not a doctor. I had rolled off the couch whilst napping, had some issues getting up from the floor, attributed it to being very tired, but I wasn't able to get any leverage off my right shoulder. It was very awkward. Finally got some help getting back onto the couch and fell back asleep. Woke up a couple of hours later. While washing up, I noticed that my collarbone wasn't protruding on my right side. Like, at all. Asked my hubby to take me to the ER. Thought my collarbone was broken. Sure, honey, sure. And he drove me to the ER. Tri-edged nurse rolled her eyes at me when I explained what I thought was wrong. We'll get to you when we can. At the time, this hospital had a separate waiting area/clinic for non-urgent cases. I get sent down there. The attending nurse says the doctor's super busy and it will be a few hours, but could she get me anything? I ask for an ice pack, and she offers me Advil, but I tell her it won't touch the pain. No point in bickering about it, though. About an hour later, I'm in a significant amount of pain. I ask if there's a place I could lie down to take some of the pressure off my shoulder/collarbone. I get an exasperated sigh. No, there's not. And no, I can't give you painkillers. Finally, after 2 hours, I get brought back to X-ray. The technician was so funny. I'm not supposed to tell you, but it's broken. Can I touch it? I've never felt a break like that before. Knock yourself out. Meanwhile, back in the waiting room, 20 minutes later, the attending nurse had an opportunity to check for my x-rays. She apologizes to me profusely. Apparently, collarbone injuries are quite painful and uncomfortable, so no one thought it was broken because I wasn't putting up a fuss. She hooked me up with some IV painkillers. In emergency surgery, plate and 7 pins later, I have a heck of a scar and a funny story to tell. Next story. So we're in this small treatment center in a small island in Greece, night shift, and this guy comes in through the ER door. Now, I want you to imagine the most typical bulky Russian guy, 2 meters tall, wide as a bull, and just straight up menacing. This is the guy you see in movies bouncing at a mob club. So he's walking slowly towards us, and in broken Greek he says, "Tummy hurt," with the most thick Russian accent. He's holding his abdomen and has a sour face, looking like he has some GI issues, so we point him to the internal medicine room after he does the paperwork. He takes his time, reaches the bed, and just sits there, chilling. We ask what's wrong. Again, same answer. Just a small tummy hurt. Yeah, he was shot 3 times, and I'm pretty sure he walked it off. Came here on his own, and the only thing he figured he should say is a chill tummy hurt, like it's a Tuesday and he had some indigestion. Next story. Not a doctor. Shh, but a community pharmacist. Had lots of both sides, but here are my favorite underdramatic patients. Older man comes in with chest pain, he describes his indigestion. Ask him if he has any history of cardiac troubles, and he says no. Had a checkup last week and all was well. He's sweating like mad though and looks genuinely unwell, so we do a blood pressure and heart rate reading just in case, and it's through the roof. He very calmly continues to protest to me, his wife, the first aiders, and eventually the ambulance crew that he really does feel fine. The young pharmacist is probably just overreacting. They take him in just in case. A few tests, and it turns out he's on the cusp of a huge cardiac event. Is out through for a stent to be put in his coronary artery merely a couple of hours after I see him in the pharmacy. One of my patients who's currently going through the long road of heroin addiction recovery, and as a result is seen every day for related care. One day comes in with an absolutely enormous burn on his ankle/lower leg. He's barefoot because it hurts too much to put his shoes on. But what is worse is the huge sack of fluid, a blister of impressive size, hanging from it, dragging on the floor. Calmly, he limps over before asking me solemnly, "Do you think I need to go to the hospital about this?" "Yes," I say. "Yes, you should." Next story. I feel like I'm a bit late, but regardless, I'll still explain and see if anyone notices. So I'm not a doctor or anything, but my grandpa is, or better, was, because he has now been retired for about a decade. The thing is, back in the day, while he was a doctor, he used to be very, very good at diagnosing illnesses and administering the right cure. But with age, those things fade. Well, cue in spring from last year, spring 2019. He had been perfectly fine until he wasn't. That spring, he had a few complications with his lungs and heart and almost didn't make it. The family, though, came in clutch and was able to get him the proper care and the right doctors and whatnot. Since he almost died, the whole fam started being more aware and keeping a closer eye on him. He thought they were exaggerating and hardcore ignored them all and thought he was fine because he hadn't self-diagnosed anything wrong with himself. The problem is that he was supposed to be taking certain pills to keep things on check. He thought they were useless. Fast forward to last Christmas. He had been fine for the past half a year. Fam was still on the edge, but not so much. Someday at noon, he starts talking about a slight difficulty to breathe, but nothing to worry, because he's had it for the past 3 months and it hasn't been a problem. We all look at him like, for the past 3 months? And he just kind of nods and goes his way. My uncle, a biochemist who works in a private hospital, and my mom quickly scramble to get him to my uncle's hospital, just to be sure that he's all right. They go to his usual doctor. She insists that he go take an x-ray of his lungs just in case. In usual fashion of my grandpa, he complains and strongly resists, but finally they get him in there. In there, a 30-year-old x-ray technician takes him to the machine and leaves my uncle and me waiting. Remember, he was complaining of a mild annoyance in his lungs, nothing more. But 5 minutes later, my mom and uncle witnessed the technician run out with the x-ray folio on one hand and a serious face. She shows them where there should be the white shadow of the right lung, there's nothing. You could see the white x-ray shadow of the left lung, but the right one was nowhere to be seen. They all both realized crap was serious. They showed my grandpa, a former doctor, and the man was vibing, telling them to stop bothering them, that he had to go watch a soccer game that afternoon. But lo and behold, the technician, a sweet young lady, grabbed him firmly by his arm and forced him to go to the ER. She insisted she gets him there so that she can speed the process up so that he goes in ASAP. They got in all good, no troubles, but the underdramatic part comes when the emergency doctor goes to meet my mom and uncle with a worried face and tells them that he inserted one of those tubes to drain lungs and that in less than 5 minutes, he had gotten out more than 2 liters of pure pus. What did my grandpa do? He told the doc to press down, because otherwise he would miss the match. The ER doc was shocked, and this man had been in the ER for strong 10 years. He swears he had never seen someone so close to death and so nonchalant. Anyway, he survived. He had the entire lung collapsed. He's literally 24 hours away from dying, but he's still alive and kicking. Thank God, and thanks to my fam and all the docs and nurses and technicians. Sorry for the bad format or whatnot. I'm on smartphone. Next story. We had a dude who had compound fractures in both lower legs. He was pretty chill until the ketamine hit, and he didn't react well. Story was that he was arguing with his girlfriend, tried to leave. She stood in front of the door and said something along the lines of, either go through me or off the balcony. He chose off the balcony, 40 feet up. That's my first and so far only time seeing bones stick out of someone. Next story. My wife is a dentist. Like most medical professionals, she has plenty of stories. This one is one of my favorites. Anyone who's treated kids knows that the parents can be worse to deal with than the patient. The clinic pediatrician was on vacay, and my wife was on call for emergencies that week. While we were eating dinner, my wife gets called in saying there was a young child, 6 to 7, that messed up her tooth when playing and was in severe pain. When my wife arrives, she finds that the child is pretty chill, but the mom was red in the face with anger. She yelled at my wife for taking so long. We live 5 minutes from the clinic, while her baby is in so much pain. My wife glances at the adorable little girl who said, "Hi," then smiles and waves at my wife. Then looks back at the mom, who started yelling again, "See, my baby is in so much pain." My wife calmly lets the mom know that she's here now and will take a look. I'll spare you all the long, tedious details and cut to the chase. The little girl just knocked out a baby tooth, and there was no actual damage anywhere else and wasn't in any pain. After my wife is done, she says to the little girl that she'll be okay, and that it wasn't anything major. The little girl was all happy and smiles and says thank you. The mom then steps up and starts up with the shouting again, berating my wife for not doing enough. My wife is beyond frustrated with the mom's outburst by this point, but before she could say anything, a little voice spoke up. "Mommy, the nice lady says I'll get a new tooth. We can go home now." It was obvious that this wasn't the first time the mother did stuff like this. The mom sputters and eventually relents. My wife does the usual spiel about taking pain meds as needed and to come back if the pain returns. The little girl turned around to say bye to my wife and left. My wife turned to her assistant and just sighed. The young assistant, who had been completely silent up until now, whispered, "Wow, that mom was annoying." Next story. Not a doctor, but I think my mom belongs here. When she was pregnant with me, she took a visit to America to visit her friends. One morning, she wakes up in their guest room and goes to take a shower to start getting ready for the day. Halfway through the shower, she realizes, oh crap, the baby's coming. So she sits down on the toilet and delivers me herself, then goes to wake up my dad to go to the hospital. He was apparently very confused, panicked, and called 911. Somehow, the news got involved too. We have a tape of me at like 1 hour old on the news, and my mom is very calm, just talking to the reporter. Next story. Not a doctor, but I've got two. So it's our anniversary, and my hubby and I decide to go to a movie. Mad Max Fury Road, to give you a time reference. My back is a little uncomfortable walking there, so I tell him we may need to swing by the chiropractor before our dinner reservation. Short story, by the end of the movie, I couldn't breathe without back pain, so he left to get the car. We drove to the chiropractor, and after my appointment, I'm in significantly less pain. And bonus, we can still make our dinner reservation. Then hubby tells me he's not feeling great, has some pain in his abdomen, and maybe we should go to the ER. Apparently, he'd been hurting for hours but didn't want to ruin our anniversary, then prioritized my pain over his. So he drives us there and walks into the building. He's very pale and has the grip of a gorilla, but not really complaining. Once his pain meds kick in, his color returns and he can breathe again. Testing showed a kidney stone, an 11mm kidney stone. There were doctors and nurses sticking their head into our room to look at the guy who drove and walked himself to the ER with an 11mm kidney stone. Second story. Father was a motorcycle police officer back in the early 90s, driving on the highway going up a hill to cross over a bridge. No way to see the truck that was stalled in his lane until too late. He laid his bike down under it, got up, and started directing traffic around it. Called in backup, got the truck occupants to safety, etc. Backup arrives and starts to help my dad work the scene. One of the guys asked my dad what's sticking out of his leg. His bone. Next story. I have a condition that makes it easy to dislocate almost any bone, so I'm a visitor to the same ER often. Since I get to know the people there, I always bring candies for the people working there. Got a bag ready to go if needed. So once I dislocate my arm and it was hanging in a completely unnatural way. The ER was full. While waiting my turn, this lady came in and went all Karen with the check-in nurse. The nurse was very patient, but at some point she lost it. She told the woman in a nice but firm way, quote, "The woman over there with the arm hanging is in much more pain than you and even brought candies, so sit down and wait." I literally took my limp arm with my other hand and shake it hello. She freaks out. But really being nice does not take away anything. Next story. This is actually a pretty interesting case, so I wish I had gotten to this thread before this comment gets buried. My dad, an OBGYN, told me about this, but he wasn't directly involved with the case. A pregnant woman came into a gynecology practice and she was clearly already very far along. By visual, she was at least 8 months. She supposedly hadn't seen any doctors up until this point, so ignoring the extreme irresponsibility of this woman, the doctors proceeded care. They ran some tests on her, and she checked off all the boxes for the most part. Everything seemed right as rain. They finished up with an ultrasound, and this is where things got weird. They had trouble making out a picture of the fetus, which on its own is not that unusual. High levels of gas can disrupt the ultrasound machine. What really concerned the doctors was that they couldn't detect a heartbeat. The woman insisted that she should be induced so that the doctors can maybe save the child if something is wrong that they can't see. The doctors agree to send her over to the hospital. After hours upon hours of attempts to induce labor with no results, the doctor suggests a C-section. The woman agrees, so they begin the process. They popped her with an epidural and began operation. They delicately cut into the uterus and there was no baby. She wasn't pregnant. How? She had the full baby belly. She passed pregnancy tests. She showed all of the hormones that pregnant women produce. It made no sense. It's a very, very rare condition called pseudocyesis. It's essentially a phantom pregnancy. You show all the real symptoms of pregnancy, but you're not pregnant. I suppose that would fit in with overdramatic patients, huh? Here's an article if you want to learn more about the case. There's many other articles as well. Next story. Not a doctor, but followed my girlfriend in to have her appendix removed. I was sitting next to her as she was casually scrolling with her phone. A nurse comes in, asks her what number she would rate her current levels of pain. She says 8 out of 10. I've had gallbladder stones passed for 45 minutes. making me wish to pass out because I couldn't endure the pain. That's maybe an 8 out of 10. Scrolling Reddit on your phone is not 8 out of 10. Next story. Okay, not a doctor, but my lack of showing pain got me more than a few effy looks. I set myself on fire after trying to throw a pan of grease that had caught fire on my stove out the back door. Wind hit it at just the right, very wrong moment and threw the flaming grease back on me. My polyester pants melted onto my skin on the outer side of my right thigh. My arm was flame. I got it out and pulled myself together enough to drive myself to the ER, parked my car and walked calmly in. I did hurt. I hurt so bad that I feared I'd lose my crap if I even dropped a single tear. The triage nurse was looking down at his computer and, without looking up, asked why I was there for. Nurse says, "And how can we help you tonight?" And I say, "I got a burn that probably needs to be seen. There's a clipboard and pen up there. Fill it out and bring it to me." Still has not looked up. Me, now that I have what I refer to as the Great Southern Guilt. I'd die if you thought I was a bother to anyone. Even in this state, I assumed he was just super busy and maybe someone needed his attention more than I did. I took the cupboard and walked to the side to fill it out. I couldn't take the pain of sitting. A few people walked past me with absolute horror on their faces. I try to sink back against the wall, finish my paperwork, and make my way back to the desk. Before I can, the door swings open and a doctor is standing there walking someone out. He takes a look at me, smiles, and I smile back. He looks again and goes ghost white. I tell him I'm sorry, I don't mean to be in the way, just taking this back. Waves the clipboard. He tells me we'll worry about that later, screams at the nurse to get my name and get me into a room right goddamn now. The nurse takes one look at me and I start to apologize. I tell him I'm sorry, I didn't mean to get him in any trouble. He gets red-faced and looks like he's about to cry. "You're an emergency, you're not a problem. Did you drive?" And I say, "I did." The nurse looks me over. My God, takes me to a room. I think it was a trauma room. It only felt like a minute tops, but by the time I got there, at least 3 nurses and a doctor were in there in gloves and a gown. One of the nurses looked and asked my name and what happened, then asked my pain level. I hurt so badly I couldn't even think at that point. I just stared at her. I distinctly remember her saying, "Honey, how bad is the pain?" "Bad," is all I could say. Someone, the first nurse, the doctor, I don't know who, said, "She drove here, like that." I promptly passed out in a slow, echoing darkness of throbbing pain. I apparently did scream once as they were scraping my melted pants out of my thigh. I never stopped to look at myself, but apparently I look pretty freaking bad. I have since found my testicular fortitude and rarely suffer from the Great Southern Guilt. That was 15 years ago. Thankfully, I only have one hardly noticeable scar. Next story. It was me. I very calmly went into shock after locking my neck on the way to the hospital. I told my husband, "I'm going into shock now. Here's what the doctor needs to know." Told him how it happened and level of pain, then just shut down. I felt my arms and legs change temperature. My lips almost felt numb. Brain just powered down and I couldn't really speak. It was such a strange feeling. Then, when I was triaged, the nurse wasn't very concerned, but I was in a lot of pain and panic that they'd just send me away with a neck injury. So I ended up hyperventilating, breathing into a paper bag, and got an x-ray done, I think just to calm me down. It was a bizarre and embarrassing day. I was given some strong muscle relaxants, and it eventually sorted itself out a couple days later. Next story. We had a call for a 911 trauma on its way to our ED for a child who was accidentally run over by a riding lawnmower. Reports were that the patient was essentially eviscerated. They roll the child in, and I'm expecting the kid to be unconscious and unresponsive, but the kid was wide awake, their innards hanging out of their abdominal cavity, not crying at all. Only time they showed distress was when the nurse tried to insert an IV. We got that kid straight to the OR as soon as we could, and he ended up okay in the end. But I'll never forget how calm he was, considering I could see his kidney when he rolled in. Next story. Underwhelming. Not a doctor, but I work in a hospital. I had a patient that did not believe the coronavirus was a real thing. She did not believe that COVID-19 was real. What was she there for, you ask? COVID-19. She believes she has pneumonia, but doesn't believe that COVID caused it. She refuses all the medication. The only thing she accepted was oxygen, because she couldn't breathe. Next story. I was kind of both at once when I was around 5. Had a double fractured wrist, and because my mother was not a fan of taking me to doctors for nothing, she just told me to stop complaining for no reason. So I did. I lived a normal life for a few days until Grandma found out and took me to the doctors, my wrist all swollen and in crazy colors while I didn't care at all, since my mom said it was nothing and I was just making things up. But when they started treating me and someone mentioned me not being able to swim on our holiday in a few days with the cast I was supposed to get, I started running around the hospital, hiding anywhere I could, trying to scare the doctors and nurses off. I told them I would call an evil witch on them if they gave me the cast. Quite an overreaction, I think. Next story. My grandmother was a nurse in the ER. One time she said that a woman casually walked in and announced that she had been shot in the chest. Like, she wasn't panicking or worrying at all. Immediately they started x-raying her, trying to find the bullet, but they can't. The lady mentions that her leg is hurting, so they decided to x-ray her leg, where they found the bullet. Apparently, her heart somehow folded over the bullet and sent it through her bloodstream, where it got stuck in her leg. Next story. There's no SRS tag, so I'll share a time I was the overdramatic patient. I woke up and had some really weird symptoms, namely a hot sensation on the back of my head and some numbness and tingling on one side of my body. I was also dizzy and disoriented. I talked to my husband and Googled the symptoms, and we concluded I was probably having a stroke, so we called 911. The EMTs asked if I was drunk or on drugs or had hit my head, all of which were a resounding no. I was still convinced I was having a brain hemorrhage or something, so I asked them to take me to the hospital. After several hours at the hospital, a brain scan, and many cognitive tests, I was diagnosed with vertigo. The doctor could not explain the hot sensation in my head or the numbness, but both subsided eventually with time, and all that remained was the dizziness. I felt like such an a-hole for wasting time and resources, especially during a global pandemic. Next story. Dentist here. We deal with severely anxious patients all the time, but this one took the cake. She required triazolam plus nitrous oxide for a cleaning, and it didn't even touch her. I used a toothbrush, not even the Profi cup/scaler, to try and clean the crud off her 6 remaining teeth. She literally screamed at the top of her lungs the entire time, from a toothbrush. Then I made the mistake of grabbing a mirror, which she assumed was a shot. She grabbed my wrist, pulled me down, and tried to bite my face. Her SO was in the room and had to physically hold her down. I decided against doing fillings, which she needed, and instead used silver diamine fluoride, which is a liquid you can paint on cavities to completely stop them. No drill or shot needed. Turns the cavity black, though. I had explained this to her at length. She understood. I go to paint it on her teeth, and she's kicking the chair and flailing about like she's a 2-year-old. That's an insult. 2-year-olds act better. She was screaming about how bad it hurt. She was full of it, though. SDF is used to decrease sensitivity, but it doesn't hurt at all. I finished the appointment and told her that we wouldn't be able to work with her again. She got all quiet and meek and said, "But I felt like today went really well." Ah, the stories from residency. Next story. Not a doctor, but an EMT who worked ER. Got pulled over for street racing and trying to ditch the cop. He caught me when I made a turn into a gated community that wasn't open. Oops. Turns out he had been in my EMT class and let me off with a warning. Less than a month later, he pulled someone else over and was standing in front of his car. So between his car and the one he pulled over, writing a ticket when a drunk driver slammed into the back of his squad car, smashing it into him and then into the car in front of it. He was extraordinarily lucky the impact bounced him up onto the hood instead of knocking him down. He would have been flattened. We got a call from Life Flight that they were inbound with a pedestrian VS vehicle MVC. Never pretty. And when he got shifted to the trauma bed, here's my upside down face over his. He was a good sport and told his wife the story. She asked me later what I would have done if he'd given me a ticket. The answer? My job. Similar vein, we had another pedestrian versus car. A homeless guy that would wait just past a corner, and when a car came out of the turn from the intersection, he would step out in front of them and get bumped. He pretended to be blind or severely visually impaired, and that was his gimmick. He was looking for a warm place to stay with free food, and we were better than the jail. He would get x-rayed, cleaned up, and discharged. He'd hang out in triage in a wheelchair, irritating other patients until we called the sheriffs. He'd latch on to some pretty young girl with, "Ooh, won't you please help a poor old blind man?" but we always noticed it was always someone young, female, and attractive. So one day he's doing his usual trick, and the car coming out of the intersection doesn't look, and clips him, accelerating out of the corner, and sends him something like 30 to 35 feet through the air. He comes in with a fractured skull and CSF leaking from every hole in his head, and we're 100% not equipped to deal with what he needs. We tell him he's getting a life flight from here to the nearest level 1 facility, in a city over 100 miles away. Turns out his little game has already worn out his welcome in that town, and he has no interest in going there. He tries to sign himself out against medical advice, saying he's fine and doesn't need medical care. Nah, dude, you've got an open skull injury, and the doctor is certain you're not competent to make that decision. You're getting titled and getting on that bird. They got him in the air and flew him out, protesting the whole time that he was fine. Just untie him and he'd go on his way. Never saw him again.